the COVID Safe app and QR scanning, still plenty of discussion about who is using this data and how effective it is. And this week we heard in National Cabinet Prime Minister Scott Morrison saying that, well, he revealed the states have agreed to improve the contact tracing system. What needs to be done?
Yeah, it's pleasing to hear that they're pushing towards this. What we need to see is data readily available so that when somebody is diagnosed as being infected, we can quickly go back and see who else they've been in contact with since the incubation period. And that means in the order of 14 days past anyone that they've traced or anyone that they've come in close contact with. Previously, we've seen the manual systems that have been favoured to date in Victoria and some of the other states are just incredibly laborious, and it's taking hundreds of man-hours to get through and trace just single people. So using digital techniques like the QR codes has dramatically sped up the ability to see who you've been close to and who needs to get COVID tested.
So why are states like Victoria not using the QR code?
That is a terrific question. It seems to me that we have some of the states are reacting rather than planning. Unfortunately, we've heard the Premier of Victoria state that sometimes manual systems are best. And in this case, his own people became swamped trying to trace before the lockdown 2.0 in Victoria. They became swamped with the manual system. So I can't tell you why they're not using QR codes now. The ACT offered Victoria to use theirs. Scott Morrison explained while they were still in lockdown that New South Wales was the gold standard in contract tracing, and in New South Wales, every pub and hotel needs to provide QR code scans and details of their patrons within 24 hours of the event, so the government can quickly trawl through those if there are any cases of infection. And Victoria has resisted to date. Interestingly, they've now decided to build their own app rather than taking something that's already used. So I can't explain why that is, but it strikes me as it's reactive and it's political posturing rather than just sensible management of a situation that we have.
So you say that they're planning on building their own app, and we just heard the National Cabinet is saying that they're going to improve contact tracing systems. The original COVID Safe app that we've had, there has been a few clinks here and there, and well, certainly we're hearing overseas as well that it's becoming successful. How is it going, and how do you think it will go?
Yeah, technically, the Australian team actually did a really good job in a technical sense. So Singapore was the first to run with this idea, and it's actually really elegant. It takes consideration for the privacy requirements of countries like Australia, where we don't want our credit card details and our health history and stuff, and maybe even lists of exactly where we've been the last 2 weeks readily available to the public. And they designed the system very well with the learnings out of Singapore to just store on your own phone whenever you've come in contact with anybody else that has the app on it. And that information is only provided to government officials if you or one of the people that you come in contact with have recently been infected. And then the only thing that's being shared is your mobile phone number and your name. It's not giving RA details about where you've been or what you've been up to or anything like that. So it's not quite clear to me why Victoria, while they haven't got a digital solution, why they wouldn't embrace this. But I think that some of the alarmism around privacy has not been addressed with the media information that's been released around this app. But it's actually really well designed to the extent where places like South Africa are copying it, and the UK has recently announced that they're going to be using it based on the same foundations. They're going to be developing their own apps for that.
And it's not just through the pandemic. I mean, post-pandemic, what do you think we need to be mindful of?
Yeah, I think it's very easy for people to now that we're hearing talk of vaccines, it's very easy for people to think, oh, it's all good now. But what we're actually hearing is these vaccines are actually going to be quite difficult to distribute. They need to be stored at minus 70 degrees Celsius. They need to be thawed out, and before the virus becomes inactive or dies, it has to be administered. So we're expecting that even if the vaccines are successful and made available from March, the country won't be vaccinated until the end of the year, and then it's likely to be an annual process. So it's not a fix. It definitely helps, but it's not going to be available straight away. And I wanted to paint that picture because contact tracing has to be part of this going forward, even to decide who gets the vaccine first. It's got to be, people that are in harm's way. So we'd want to know where the traces are, where the outbreaks are occurring, and make sure we can get vaccines to as many people as possible before they're infected.
Great information. Thank you so much for joining us today, Tim Gray, Managing Director of Prophit Systems.
Thanks, Jamie.